Located in Jupiter, Florida, the Hand Center provides state-of-the-art medical and surgical treatment for problems involving the upper extremity. Dr. Charles Eaton heads a talented, caring team of physicians and staff committed to providing the finest, most advanced surgical techniques for the hand, wrist, and elbow. Dr. Eaton has performed the needle aponeurotomy for the treatment of Dupuytren's contracture on well over 3,000 hands since 2003.
Well, our mission at the Hand Center is threefold. The first is to seek out and to provide new and cutting-edge technology for patients with hand problems with the goal of having a quick recovery and minimal risk compared to traditional treatments. We also are very focused on the internet and use that as a source to evaluate new procedures and to educate our patients and my colleagues regarding new techniques. Most recently, we've gotten involved with a new treatment for Dupuytren's contracture, which has been a problem that's baffled surgeons and their patients for over 200 years. It is very gratifying to practice hand surgery because the hands are very personal. The hand ultimately is an extension of the brain. And when someone has problems with their hands, it has a profound effect on their lives and their ability to work frequently and their entire self-image.
Tom Strish had lived with a crippling deformity in his hands long enough. His primary doctor couldn't help, so he turned to the internet, looking for any new medical treatment options that could provide some relief.
Several years ago, I noticed I was beginning to have trouble with my hands. And my doctor told me that I had a condition called Dupuytren's contracture.
Tom is not alone. 8 times more prevalent in men than women, 3% of the U.S. population, primarily seniors, suffer from Dupuytren's. For nearly 200 years, the standard treatment has been open surgery, but with limited success.
Dupuytren's contracture is a benign inherited condition that affects a layer of tissue just underneath the skin of the palm. It produces a shrinking process in little lengthwise threads that run up into the fingers, and when they shrink, this pulls the fingers down like tightening up the string of a bow, and the finger simply can't be straightened out, and over time it tends to progressively bend more and more. The biology of Dupuytren's is an abnormality of part of the normal wound healing process, and when you do surgery it tends to flare that up, and so many people do well, but it's a very long recovery and it has a higher risk of permanent complications than other operations in the same area.
Put off by the mixed results of traditional surgery, Tom turned to the Hand Center in Jupiter, Florida. Dr. Charles Eaton has introduced and refined a minimally invasive in-office procedure for the treatment of Dupuytren's contracture. This needle aponeurotomy offers less risk, an easier recovery, and better results than traditional open surgery.
The idea is, rather than opening up the skin surgically, to make small entry wounds that with a needle to cut the tight strings underneath the skin. This can be done with almost no anesthesia and has an immediate straightening of the hand. People are able to simply have Band-Aids on their hand for a day and to resume pretty much all normal activities by about a week out. This is compared to normal recovery of several months after traditional surgery.
Well, having been a hand surgeon for many years, I've seen and tried everything. And this particular procedure's advantage is it's simpler, less invasive, faster recuperation, and for those people that have had both, the vast 98–99% prefer this one. And people are genuinely happy. I mean, basically that's the end result of any procedure. If the patient, for example, had a fasciectomy on one side and this needle aponeurotomy on another side, and the patient tells us which they like better.
I found Dr. Eaton on the internet when I was looking for someone to help me with my condition. And it's been about a month ago that I had these procedures done. And I can't tell you how wonderful it is to have recovered the full use of my hands. Dr. Eaton is just so marvelous, and his staff. They let you know exactly what to expect and what they're doing, put you at ease. Whatever I do that requires the use of my hands, I just marvel that I'm able to do it without restrictions.
When I learned about it and learned the technique, and that information became available online, not by me, but through other discussion groups, then my phone started ringing off the hook, and I realized that there were a lot of people out there who really did not want to repeat the experiences that they had had before, or that people that they knew had had before with traditional surgery. It's been very, very gratifying. Often when doing the traditional surgery for Dupuytren's, it's a big slog for the patients. It's a long ordeal of recovery, and by the time all the dust settles from surgery, patients are really more exhausted than happy. The immediate gratification aspect of this procedure is something that makes people very grateful and very thrilled, and really kind of caught me off guard at how excited people have been to have their hands back.
The patients actually participate in the procedure, and they could see immediate results. So by the time they walk in and then leave, they're markedly different, and the smile on their face, the marked change in something that's been going on for years, that within an hour is markedly different, is extremely gratifying. Dr. Eaton and I have known each other for a long time from our fellowship training in New York City at NYU. And I think it's a very special relationship. We learn from each other, we tweak each other, try to make things better. And it's been a mutually beneficial relationship, both for ourselves, our own education, and even more so for the patients.
I am one of several people in my family who have Dupuytren's contracture. I had the conventional surgery in my left hand in 1999. Tons of stitches, lots of pain, and I'd never want to go through that again. And as the years continued, I noticed I was getting the same thing in my other hand. And a relative of mine saw the article in the New York Times explaining what Dr. Eaton does and the procedures he uses. And living in Florida, I became the family guinea pig to go have it done. And I came, and I'm extremely pleased. The outcome was great. The pain level was minimal. I didn't even take a Tylenol afterwards. I totally recommend it for anybody who has this problem.
Before the procedure, I was not able to put my hands together as though I were praying like this. And neither was I able to put my hands flat down on any surface. I would gladly recommend the Hand Center for anyone who would require this procedure, because you could do this again. And those of you who are not able to do that now would know what solace it would bring to you to be able to return to that type of position.
We're very excited about what's happened at the Hand Center, and the thing that's been the most interesting to follow is the emerging and ongoing role of the internet in educating patients and surgeons about new techniques and new technologies for treating hand problems, to be able to provide treatment that is an easier go for patients. It's also important for patients and surgeons to continue to use the internet to share experiences and collaborate. There are new techniques currently available and much more on the horizon. It's important for patients to be educated consumers and to use the internet to see what their options are.
For more information on minimally invasive treatment for Dupuytren's contracture and other hand problems, call 561-746-7686 or log on to handcenter.org.